We are pleased to present to you a Coalition Plus success story supported by Robert Carr Fund, reinforcing community-based strategies in the national HIV response in the Republic of Congo. We work at INSS, a community-based NGO in Burundi. INSS is a member of Coalition Plus, bringing together 18 CSOs. We coordinate one of 6 Coalition Plus regional platforms called PASS. Our main strategy in capacity building are pulling the best practices in the fight against HIV, sharing data, feedback, and challenges, replication of best practices. In Congo, we knew there was an opportunity. The authorities had already committed to HIV community based testing, but without goals and means. The Republic of Congo has always been a priority for us because of the epidemic context, recurrent supply ruptures, and stock out of ARTs. In Congo, we worked with the National Network of Positive People in Congo, RENAPC. As a first step, in May 2019, we undertook an organizational diagnosis at RENAPC to identify its SWOT. Then, we met the institutional stakeholders to evaluate the national HIV response. As a second step, in December 2019, we organized a training on community based HIV testing, followed by a press conference. We also met Red Cross and the Global Fund PR to get a commitment to RENAPES's program of testing implementation in terms of inputs. Past activities combining capacity building and advocacy have highly impacted the national response even more than expected. 25 RENAPEC peer educators are now able to test in their community, and inputs are now available for community testing.
Pour nous une aubaine à saisir, donc on l'a saisi. Cela nous permet aujourd'hui d'être capable de dépister nos pairs, donc faire avancer le 90 de l'ONU. On se sent vraiment capable de travailler dans le cadre du dépistage sans pour autant dépendre du corps médical. Donc, c'est pour nous une sorte de pouvoir que nous détenons aujourd'hui. Ce n'est pas tout le monde qui ira se dépister dans le centre santé, tout en sachant qu'il y a des discriminations, il y a des violences psychologiques et il y a aussi la peur. Or, quand ça se passe en pair, c'est plus facile et c'est plus fluide.
National regulations have also changed. The Ministry of Health produced an official statement about the task shifting in the national HIV response. At the same time, RENAPC has been allowed to practice community based HIV testing and dispense ART.
À partir de cette formation et leur leadership, nous avons vu vraiment l'importance de l'implication de la société civile dans la lutte contre le VIH-Sida. Et là, vraiment, la PAS a été le moteur pour que nous fassions confiance à nos associations et nous les impliquons pleinement dans les activités de prise en charge.
The most valuable outcome for us is the recognition of community actors. Valérie Maba has been elected as president of the Congolese CCM. PAS has become RENAPEC's main capacity building provider with the support of the French public funding partner, l'Initiative. And since COVID-19 broke out, community actors have been involved in the national response.
Ma première formation que j'ai bénéficié au niveau de ANSS Burundi a permis que je puisse avoir une bonne feuille de route de travail au niveau des CCR. Après mon retour, c'est vrai que le temps était court, mais vu que l'engagement était là, nous avons pu mener les mini-dialogues au niveau pays. On a pu avoir la notification pour le paludisme. Et là, avec COVID-19, nous avons aussi rédigé une proposition, c'est acquis. Nous avons besoin que notre plateforme La Passe puisse continuer à exister.
After these successes, we are more determined than ever to continue to support Congolese community actors. Our next activities will be to support RENAPC structurally, to scale up CB HIV testing, to support implementation and dispensation of community-based PrEP and ART, and finally to support psychosocial care activities. In this context, RCF granted support will be very central. We hope you continue to be great allies in recognizing and promoting community expertise. Thank you for your attention.